Which of the following ECG findings indicates the presence of hypokalemia? A. Tall peak T waves. B. ST segment depression. C. Widening of QRS complex. D. Prolonged PR interval. And the correct answer is B. ST segment depression. ECG changes during hypokalemia are shallow, flat or inverted T wave, ST segment depression and prominent U waves. And in opposite condition, ECG changes during hyperkalemia are tall peak T waves, flat P waves, widening QR complex and prolonged PR interval. A 10-month-old is brought to emergency room for a head injury after falling down the stairs. An immediate CT scan is ordered. What preparation should be done before CT scan? A. Shave the infant's head. B. Administer prescribed sedatives. C. Start the prescribed IV injections. D. Explain the procedure to the infant. And the correct answer is B. Administer prescribed sedatives. Patient should be lie still and flat during CT scan test because 10-month-old infant cannot follow the instructions to lie still, so sedative may administer as per prescription. A physician considers performing a MRI test on the elderly client with cirrhosis. Before the MRI is performed, which nursing action is essential? A. The nurse administers a pre-test sedatives. B. The nurse records the client's body weight. C. Nurse removes the client's dental bridge. D. Nurse inserts a Foley's retention catheter. And the correct answer is C. Nurse removes the client's dental bridge. Because of the powerful magnetic field of the MRI system can attract objective made by certain metals and cause them to move suddenly and with great force. This can cause of a possible risk to the patient or anyone. As a patient is vital, remove all metallic belongings in advance of the MRI examination. Nurse should be alert of following complications after patient has undergone bronchoscopy. A. Bronchitis. B. Hemoptysis. C. Pneumonitis. D. Pneumothorax. And the correct answer is D. Pneumothorax. Most common complication of bronchoscopy includes pneumothorax, that is air entry into the lungs. Other complications are bleeding from nose, shortness of breath, hypoxia, during procedure chest pain and cough. Bronchoscopy means examination of the bronchi through a bronchoscope. The higher priority of information given to a patient after bronchoscopy includes A. NPO for at least 2 hours. B. Warm saline gargle 2 hourly. C. Coughing and deep breathing 2 hourly. D. Only ice chips and cold liquids allowed. And the correct answer is C. Coughing and deep breathing 2 hourly. In additional, no food or liquid by mouth also suggested until the gag reflex is returned. Fifth vital sign is A. Mean arterial pressure. B. Pain. C. ABG analyzing. D. Saturated oxygen. And the correct answer is B. Pain. As a fifth vital sign, we can give first priority to the pain. While taking temperature from rectal route in children, thermometer should be inserted about A. 0.5 inches, B. 1.0 inches, C. 1.5 inches, D. 2.0 inches. And the correct answer is B. 1.0 inches. While taking temperature from rectal route, thermometer should be inserted about 0.5 inches into infant. 1 inches into children and 1.5 inches into adult. The thermometer in which results are seen within 45 seconds is A. Electronic thermometer, B. Clinical thermometer, C. Disposable thermometer, D. Tympanic membrane thermometer. And the correct answer is C. Disposable thermometer. Both electronic and disposable paper thermometer provides reading in less than 60 seconds. Tympanic membrane thermometer provides result in 2 seconds. Most reliable method of taking temperature is A. By rectum, B. By mouth, C. By axilla, D. None of above. And the correct answer is A. By rectum. The rectal method of taking temperature is most reliable because rectum contains large amount of blood vessels and also the thermometer not exposed to external air while taking temperature. To correctly palpate the patient's skin for temperature determination, a nurse will use A. Base of hand, B. Fingertips of hand, C. Dorsal surface of hand, D. Palmar surface of hand. And the correct answer is C. Dorsal surface of hand. The dorsal surface is the back surface of the hand and it contains more temperature sensitive receptors. So, dorsal surface of the hand is used to measure temperature of the patient's skin. The number of pulse beats per minute known as A. Pulse rate, B. Pulse volume, C. Pulse tension, D. Pulse rhythm. And the correct answer is A. Pulse rate.